Good morning, this is Matt Walsh with your Minute with the Mayor for Friday, April 24th. To date, there have been 20 confirmed cases. 17 of those patients have recovered. 2 patients are self-isolating at home, and we've experienced 1 death. There have been no confirmed cases in long-term care facilities. A couple of weeks ago, I referenced serology tests that are taking place in Los Angeles County. Los Angeles County, by population, is larger than 40 of our 50 United States. They are the first major U.S. municipality to announce the results of their antibody testing, and New York serology tests results quickly followed. A serology test looks for the presence of antibodies, which are specific proteins that are made in response to infections. Antibodies can be found in the blood or other tissue of those who were tested after they were infected. The antibodies detected by this test indicate whether a person has had an immune response, whether symptoms developed or the infection was asymptomatic. The test subjects are randomly selected by a significantly large sample of people to smooth out random abnormalities. Serology testing is deemed essential by public health officials to safely reopen the country. Evidence from Los Angeles County is that the novel coronavirus may have infected around 4% of its 8 million plus population. Evidence from New York is that 21% of the New York City residents tested positive. In the entire state of New York, 13.9% tested positive for the antibody. It's important to note that a total of 15,740 people have died so far in New York. Why the disparity between California and New York and their test results? Experts say it's likely that different areas of the country will show differing infection rates. More people in New York City, for example, could have been infected because it's the hottest of all hotspots. It's also important to understand variables within the sample, like how people's lifestyles can affect infection rates. Californians are more inclined to travel in privately owned vehicles, while New Yorkers frequently share public transportation. New York City residents tend to live in closer proximity, while LA County has a little more urban sprawl. A large swath of the population appears not to have been infected yet, which means that we are still very early in this epidemic. Many more people could potentially be infected. If you remember previous discussions, we don't approach what's considered herd immunity until 70 to 80% of the population have been infected. But this also provides new evidence that the virus isn't as deadly as scientists had initially feared, as deaths stem from many more infections than were previously known. Serologic tests should not be used to diagnose acute or prior infection, nor should they be used to determine immune status. They may produce false negative or false positive results, the consequences of which include providing patients incorrect guidance on preventative interventions like physical distancing and protective equipment. That's your Minute with the Mayor. Have a good weekend.